Welcome to the Daily Brief on Metro Milwaukee's health and economy, brought to you by the Medical College of Wisconsin and the Metropolitan Milwaukee Association of Commerce. I'm Tim Sheehy, president of the MMAC, and I'm joined by my co-host, Dr. John Raymond, president of MCW. Each day at 3:30, we deliver a 19-minute fact-filled update on the health and economic impact of COVID-19. This webcast is powered by Aurora WDC. And our guest today is Bernie Sheehy, CEO of Ascension, Wisconsin, one of the leading healthcare providers on the front lines of this crisis. But as we do every day, we're going to start with an update from Dr. Raymond.
Thanks, Tim. Over the last 2.5 weeks, we've been tracking the efforts of Wisconsin and the Milwaukee region to flatten the COVID-19 curve. And we've seen steady improvement in that the daily growth rate of new COVID-19 cases dropped from over 30% about 2 weeks ago to 12.6% yesterday. And the doubling rate of COVID-19 cases stretched out from under 3 days to 5.5 days yesterday. Now, before I read out the numbers today, I do want to thank Drs. Amin Bamanian and Kirsten Beyer of the MCW Institute for Health and Equity for providing us these timely calculations each weekday. They and their colleagues are eager to partner with MMAC to provide an expanded dashboard to you in the coming weeks. All right, so today there were 94 new COVID-19 positive tests in Milwaukee and 178 in Wisconsin. The daily growth rates improved again at 12.1% in both Milwaukee and Wisconsin, and the doubling rates also improved slightly to about 5.7 days in both Milwaukee and in Wisconsin. This is excellent news. But we do want to see the doubling rate stretch out to over 7 days and beyond as soon as possible so that we can avoid overwhelming the capacity of ventilators and ICU beds within the next week to 10 days. Now, in that regard, we also have some good news about increasing the ventilator capacity and the ICU capacity in the health systems in our region. We're also learning more about effective ways to deploy ventilators and to triage COVID-19 patients who have respiratory distress. And we do that by carefully applying lessons learned from Italy, Spain, Seattle, New York, Detroit, and New Orleans. I also want to share with you today that there appears to be an emerging new cluster of COVID-19 cases in West Dallas. I'll give credit to my wife for notifying me a few minutes ago after she examined the heat map function on the Milwaukee Health Department COVID-19 page. That's an outstanding page, and I encourage you to bookmark their site. This new cluster highlights that we must continue to push hard, to be vigilant, and to act with a sense of urgency so that we can continue to flatten the curve. What we do now will impact what happens 1 or 2 weeks down the road, and it will help us to get closer to the recovery phase for both the health of our community and the health of our economy. Next slide, please. This slide presents an infographic from an Atlanta pulmonologist and critical care physician, Dr. Victor Sang. What it highlights is that the medical impact of COVID-19 pandemic is going to come at us in waves. And for purposes of this slide, I'm not referring to secondary waves of COVID-19 infections, but rather to the ripple effects on the entire system of healthcare. On this slide, the tail of the first wave encompasses the daunting challenges that COVID-19 patients face if they're successfully discharged from the ICU. These problems include neurological deficits and damaged organ systems such as heart, lung, liver, and kidneys. The second wave results from the impact of constrained resources on patients with urgent non-COVID conditions. Examples would include shortages of hydroxychloroquine for patients who have approved medical indications, shortages of asthma medications and sedatives, delayed chemotherapy and other treatments for patients with cancer, and the delayed treatment of heart conditions because cardiac catheterization laboratories and intervention suites have been converted to create ICU surge capacity. The third wave results from interrupted care for patients with chronic conditions like diabetes mellitus and asthma. And the fourth wave involves the mental health issues and economic injury associated with COVID-19, which clearly becomes more important and more concerning with each passing day. And I would note that all of these waves disproportionately affect people of color and under-resourced communities because of the pre-existing burden of health disparities and social determinants of health. This disproportionate health and economic impact of COVID-19 is a topic that requires our full attention as we move forward. This also is one of the topics that the participants in the MMAC briefs have asked us to address. And I want to thank the participants for their insightful questions and suggestions. For example, we've been asked to address in future briefs the concept of herd immunity, and also to develop a scorecard with the actual numbers of projected ICU beds and ventilators in the region. We're working on those requests. Next slide, please. This next slide serves as a segue into Bernie Sherry's presentation. I want to assure you that our health systems are working extraordinarily well together, and they've been meeting virtually twice a week. And much of the discussions focused on involving our health systems in increasing the surge capacity for ventilators and ICUs, best practices, unified messages to our community and our stakeholders, and most recently, the alternative care facility being planned for the State Fairs Exposition Center. So thank you very much, and I'll turn it over to Tim.
Thank you, Dr. Raymond, and I know you're going to stick around for questions. So Bernie, very gracious of you to spend some time with us. I can't imagine the challenges of running Ascension in the midst of this crisis. But let me start by asking you how your team is doing and how you're addressing the challenges in your own workplace.
Letter for
Thank you. Daughter. Thank you, Tim. Thanks for having me on and giving updates from the field. The teams are doing great. They certainly a stressful time for all healthcare frontline providers. We are number one focus and priority is to make sure our physicians and clinical teams have the resources they need in this stressful time. But as John mentioned in his update, the health systems are working together, collaborating. We put a strong team of our CMOs, chief medical officers and chief clinical officers from across the community. They started collaborating very early on as we started to prepare for this pandemic hitting our communities. We just want to make sure that our physicians and our clinical teams have the PPE they need. So I know every health system is hyper engaged in making sure they have those resources. We're all following what's happening across other communities and other states, and every health system in the community, including Ascension, has been engaged in developing surge plans beyond what would be our traditional capacity within our facilities. And I think that is going extremely well. We touch base regularly with the other health system leaders, and I think everybody is staying on top of that. We're watching the numbers. We're watching the doubling rate, as John talked about, and we're trying to be as prepared as we can.
And kind of two questions on capacity. How's the capacity of Ascension holding up? And then how about access to the personal protection equipment that you talked about?
Yeah, let me start with our PPE. We're fortunate. We've got a strong resource supply group, not only in Wisconsin but across the country. So we've been successful securing PPE. We've certainly followed the CDC guidelines regarding PPE conservation measures. So in addition to procuring the PPE, we've also worked with our clinicians across the state to make sure they had up-to-date information coming out of the CDC regarding the use of PPE, how best to conserve PPE. Because early on, as we entered into this pandemic, that was the number one concern across the country. And so quickly, the CDC came out with guidelines. Most health systems across the country started to implement those, and that's been extremely helpful as we manage the resources that are available to us. But I have to give a shout out to our supply team. They've really tried to stay ahead of it, certainly anticipating, maintaining par levels, looking at days on hand based on current utilization, but also looking at the doubling rate and anticipating what PPE is going to be needed in the future.
Good. Thank you. I also know that some of your facilities, of course, are close to some of the hot spots. So how do you find your system kind of engaging with the community around it in these very challenging times?
I think outreach has been key. So we've outreached to community leaders. We've really leveraged our technology trying to get as many community leaders, whether it's congressional leaders, city, county, state, our federal leaders, just updating them on what's happening on the ground, what's happening with our frontline leaders, what are we seeing as far as trends within our community. So we've done webinars. We've also done outreach to the faith-based community. We have a urban church wellness network, and just last week, myself and our chief clinical officer, we did a webinar with 60 of our faith leaders that are in our communities near our facilities. They found that very informative. So we basically tell them, here's basically the status, what's happening, currently within our facilities, but we also are educating them and really asking them as trusted leaders in their neighborhoods and communities and congregations to go back and educate and influence where they can around the social distancing, and then also educating them on if anyone needs help, the way to access it via hotlines. We have virtual platforms stood up so they can access our physicians online, and we've seen a significant growth from that standpoint. We're doing one-on-one as well, Tim. We're reaching out to individual leaders in the community if we think they have a way to influence those that they come in contact with. I know most of that is now virtually since we're all doing social distancing, but we're trying to do everything we can to push information out to let people know that we're here for them.
Good. And then as I bring Dr. Raymond back in, and both of you can start to answer some of the questions from the audience, maybe one additional question on how Ascension or other hospitals will work with kind of this field hospital as it gets set up, I guess, and how will that work with existing healthcare infrastructure?
Yeah, when it was contemplated that the field hospital was going to be coming to Milwaukee County, all the healthcare system leaders, the Milwaukee Healthcare Partnership, the SCOC, UEOC, city and county leaders, we jumped on a Zoom call and talked about that. The first thing that had to occur was to certainly pick the site. We know it's going to the fairgrounds, but we had to identify leadership. So we all worked together and putting together an administrative team. The field hospital has to be supported by a traditional leadership structure so it can start to get to work to actually bring in the resources. So that is up. That leadership team is currently meeting and working with the UEOC and the SEOC to identify the resources that they need. John and myself and the other health system CEOs, we get updated weekly. Our clinical team, our CMOs and CCOs are staying connected with that leadership structure because we need to ensure once that is open that there's continuity between the traditional healthcare system and the alternative care facility. John may want to add some comments as well.
Yeah, appreciate that update. Chris, do we have questions from the audience?
We do. One of the first question is about another question about vaccine efforts. Dr. Raymond or Bernie, do you have any sense of how many efforts there are going on nationally or even around the world right now? And then we had a specific question about a product in development apparently called CoroFlu. Are you familiar with that?
John, I'll let you take that one.
Dr. Raymond, you may still be on mute.
I was on mute. Yeah, thank you very much. I think the CoroFlu may be the Japanese flu drug that was originally marketed for influenza that is trying to be repurposed. If I'm mistaken about that, we can look into it for the next briefing. And vaccines, literally dozens, if not hundreds of companies are rushing to try to produce a vaccine. In theory, vaccine production is pretty simple. You know the sequence of the virus. You can do a study to determine what epitope or what part of the protein is most likely to create an immune response. Then you synthesize the protein. So that's not that difficult, but getting the enough quantities made that you can do clinical trials, getting the approval, having enough patients so that your study has statistical power, all those are big challenges that take, in many cases, up to a year. They're trying to accelerate and compress that time frame down to a couple of months. And I know that there are a number of vaccine trials that have either just begun or will be beginning by June 1. But I would say that we're not going to have a vaccine that's been produced, distributed, and validated before this fall. We're really talking about next year at the earliest.
We had a couple of questions about the doubling rate, just a basic definition. And another question, would it naturally slow down when you're not talking about going to 200 from 200 to 400 versus 2,000 to 4,000, or is that not how exponential growth really works?
No, let me answer the second part of the question first. That's right. If we only have small increases in a day or no increases, then the doubling rate's not going to get worse. It's going to get better. And so remember, the longer the doubling rate, the better it is for us, because that's the period of time that it takes to double your cases. So to go from 2 to 4, or 4 to 8, or 8 to 16.
Another question is, are all the health systems working together right now in our region?
Answer is yes, but I think Bernie ought to talk a little bit more about it, because their collaboration has been remarkable.
Yeah, it's outstanding. There's really two levels of collaboration. One is with our clinical team. So as I said, our chief medical officers and chief clinical officers, they've been meeting for the last 5-6 weeks, if not longer, as soon as this started to occur in our communities, and they've doing a great job staying aligned on the efforts and working together and collaborating around the plans that each of us are putting together. In addition to that, the health system CEOs meet at least twice a week on regular update calls. And then if we need to pull together ad hoc meetings, if something comes up, one of us will reach out and we'll come together. So everybody's been extremely collaborative and accessible.
Had another question about, if we reach capacity here in the Milwaukee region, would residents be able to access care in other places? And I suppose the issue there would be people who live in those other places would need that access.
Yeah, I'll take that. I think there's great collaboration, not only within the Milwaukee County, but also the other regions of the state. And so the state has what are called the HERTs that are stood up. And so, there's good collaboration between those across regions. And so, if need be and we needed capacity beyond Milwaukee County, certainly we have access to those CEOs and those health systems, and we keep informed on what their capacity. So certainly, if needed, we could surge beyond Milwaukee County.
Bernie, can you also talk a little bit about the financial impact on hospitals, systems like yours? Because you've had to make some changes to go through and prepare yourself for the potential growth of COVID cases.
That's right. Early on, when the Surgeon General came out with the recommendation to stop doing elective procedures, all the health systems in Milwaukee followed that guidance and stopped it. So we do a significant amount of our business, our elective surgeries or elective procedures. All those have been postponed and put off, and that's a significant impact financially to all health systems. In addition, beyond what we would purchase normally, purchasing PPE equipment for our frontline staff to take care of patients is significant. I would say most of our health systems are also trying to acquire additional ventilators. So that's additional cost beyond what traditional costs are in a normal environment. So significant from an expense standpoint and a huge hit from a revenue standpoint, because we're really putting off probably 50% of our revenue related to elective procedures. And that would apply to most health systems in the region.
Yeah, that's a challenge I think we're all facing, managing the curve on the health side and also on the economic side. So Dr. Raymond, again, I appreciate your insights. We look forward to having you back tomorrow with an update. We'll have Mark Cass, the editor of the Business Journal, on to bring some thoughts and questions from their readers. And then on Friday, we'll have the mayor back, and Dr. Raymond will wrap up the week in terms of the trends. And Bernie, thank you very much for your leadership and for the role that Ascension plays in this community, and for the way in which you all are working together to help us get through this crisis. And thanks for joining us today. So with that, stay safe. We'll see you tomorrow afternoon.
Thanks, Tim.
Thanks, Tim.
Thanks, Bernie.